Principles of writing an effective patient report form. Patient report forms are a vital part of the emergency medical services field because they help ensure that critical patient information is not lost and provide a written record of a patient's assessment and treatment, which helps guide the type of care they receive and informs immediate treatment decisions. However, we see narratives that do little more than state where the patient was picked up from, where they were delivered to, and some statement that indicates that the crew left the patient no worse off than they found them, such as, "Patient transported without incident." The narrative must state the facts accurately, objectively, and completely so that the reader can answer the question. It is a vital part of the patient's health record and can provide hospital staff with verbal confirmation during patient handover. It's crucial to include key elements in the patient report form so that healthcare professionals can ensure that all the necessary information is accurately documented and easily accessible to others involved in the patient's care. PRF structure. Presenting complaint. The presenting complaint should be a single sentence that describes the reason why a patient has sought help. An example of a typical PC would be abdominal pain or headache, or in this case, shoulder pain. On arrival. Document the situation you were presented with on arrival and the appearance of your patient. History of presenting complaint. The history of presenting complaint is the key part of the history of which the clinician should spend most of their time determining the nature of the complaint. You should ask a series of both open and closed questions. Review of systems. The review of systems is typically structured as a list of questions organized by organ system, where healthcare providers ask patients to identify any symptoms they may be experiencing. This can assist in gathering a patient's medical history, which can be particularly useful for identifying conditions that don't have clear diagnostic tests. Pertinent negatives. A pertinent negative in a medical record is a diagnostic sign that is not present, or a note that a clinician makes to explain why they did not perform a procedure. They are used to rule out other diagnoses and narrow down the range of possible causes. Past medical history. A patient's past medical history is a record of their health information, including allergies, illnesses, surgeries, medications, and more. A medical history is important because it helps clinicians form differential diagnoses. Family history. A family health history can help identify if you are at higher risk for certain conditions, and can help you take steps to reduce your risk. Some basic information to collect for a family health history includes name and how you are related, ethnicity, race and/or origins of family, date of birth, place of birth, if deceased, age and cause of death. Social history. A patient's social history is part of their medical history and explores the socio-demographic factors that may contribute to their illness, their home or work life, health habits such as smoking, drugs or alcohol intake, and any additional care needs including mobility aids. On examination. The way in which the examination section is carried out can differ from clinician to clinician, where the majority tend to find it easier to follow the A-to-E framework compared to the body system framework. When you are incorporating examination findings into a presentation, positive and relevant negative findings should be provided rather than recounting the whole examination. Providing the News 2 score and stating which observations are abnormal is good practice. This is especially important for sick patients. If the patient has any recent relevant investigation findings, providing a brief statement to summarize these can add to the overall picture of the patient. The A-to-E assessment approach is a systematic approach to the immediate assessment and treatment of critically ill or injured patients. The Freedom of Information Act 2000 is designed to create a right of access, where members of the public can apply to gain access of all types of information produced and held by public authorities such as the National Health Service. Subscribe to the channel for more.